Hello everyone. Hello everyone. Our Rotractor Zoya here, and welcome to today's session on awareness of folic acid to prevent neural tube defects. Let me quote: the first step toward change is awareness, and the second step is acceptance. On this note, I'd like to introduce today's speaker, Dr. Pooja Sahani. Welcome, ma'am. Dr. Pooja Sahani is a gynecologist and obstetrician at Altius Hospital, Bangalore, with 10 plus years of experience. Dr. Pooja Sahani completed her MBBS from Dr. MGR Medical University, Tamil Nadu in 2008 and DNB Obstetrics and Gynecology from National Board of New Delhi in 2014. Dr. Pooja is also a member of BSOG, Bangalore Society of Obstetrics and Gynecology. She expertises in laparoscopic surgeries and normal delivery and high-risk pregnancy. Dr. Sahani has also achieved many awards, naming some: Understanding Cancer Metastasis, Introduction to Breast Cancer, and Introduction to Biology of Cancer. We are very pleased to have you, ma'am.
Yeah, thank you. Thank you, Zoya. So, hi, good evening to all of you. I thank you for the nice introductions here. Thank you.
Thank you, ma'am.
So this topic is very, very relevant. I would like this session to be very, very interactive because whatever things you have in mind, and I want to know what all you would like to know, because this is just a basic presentation, but I want it to be a very, very interactive session so that all of us get the maximum out of it. So shall we start, Zoya?
Yes, ma'am. Yes, ma'am. We have 100 plus, so I'm very excited for this session.
Okay. Now, what I would like to know is, like, what is your, understanding about, folic acid, and, what do you think folic acid does, and, what role it plays, in our body, and, what all it can do, what all, it's deficient, anything, like, any idea if anybody has, just the basic idea, so that I know that, okay, this much idea you have, and then I can take it from there.
So basically, ma'am, I came across folic acid very recently when COVID-19 started.
Yeah.
Before that, we didn't even, I didn't have any idea about what does folic acid basically does in our body. And also from a show, I saw that a kid had this neural tube defect.
Okay.
It was because of a mother, the mother had basically deficiency of folic acid. And because of that, the kid had this neural tube defect.
Yes.
And what is foliate and all this, there's not much knowledge on it. But basically, I just know that it helps, like folic acid will improve your hair, it'll reduce your hair fall and all these stuff. So, yeah.
So, okay, then, let me start the presentation. If anything, anybody, wants me to discuss further in that particular slide, any point you don't understand, so please unmute yourself and ask. So let's all be very interactive, and, let's clear all our doubts, and, whatever maximum I can clear for you. And, I just want it to be useful for you guys. Okay. Folic acid. Yeah, so folic acid, which is also vitamin B9, and another vitamin of vitamin B category, cyanocobalamin, plays an important role in neurogenesis. So mainly it is, important for the development of neurons, that is brain cells, and spinal cord cells. So in pregnancy, it is necessary for the effective growth and synthesis of RNA and DNA. All the cells are made of RNA and DNA. So especially when the embryo is developing inside inside the uterus of a pregnant woman. So it is very necessary that, she takes folic acid so that, the proper neurogenesis happens. And that's why the deficiency is associated with neural tube defect, and it happens in the first month of pregnancy, before you actually know that you're pregnant, because only once you miss your periods and you do a pregnancy test, only you get to know. But the embryo is already formed, and the neurogenesis has already started happening, from the day when we calculate the pregnancy period, we start from the first day of our last menstrual period. So the very first few days of the embryogenesis and all those things, the neuron starts forming. So that's why that's why we tell that, okay, when you are planning, when the couples visit us and they tell that, okay doctor, we are planning for a pregnancy, so we start them on periconceptual folic acid, so when they're trying to get pregnant, because they won't know that when they become pregnant and when the wife becomes pregnant. So we start them on supplement folic acid supplements. When folic acid is found naturally in food, it is called folate, and there are of course good sources of folate. We do have beans like lentils, black beans, green leafy vegetables. They do have natural form of folic acid, which is folate. But yes, they don't give us the adequate amount of folic acid which is necessary to prevent the neural tube defect. So for that, every woman needs 400 micrograms of folic acid every day in her as a supplement, so that the neural tube defects are prevented. See, this slide also shows that, okay, though we have folate content in other these things, leafy green, yeah.
Your screen, ma'am. We can see you live video, but we can't see your screen, ma'am.
You can't see? 1 second. Sorry. Let me just check. Can you see now?
Yes, ma'am. Yes, ma'am.
Okay. So this was my first slide. As I told you, it's important in neurogenesis. Somebody is raising hand. Anybody wants to ask anything? And these are all the sources of, natural sources of folic acid. When folic acid is found naturally, it is called folate. These are the, healthy foods high in folic acid: leafy greens, eggs, avocado. But yes, it is written that don't forget to take a daily multivitamin that contains folic acid, because they don't give us the adequate amount of folic acid, which is actually required to prevent the neural tube defect. So what is neural tube defect? They are the birth defects of the brain and spinal cord. And the most common neural tube defect what we see is spina bifida and anencephaly. So spina bifida is something like, when a particular part of the spine is not fused properly. So I'll show you the pics in the subsequent slides. And anencephaly is when the brain doesn't develop. So anencephalic babies, they don't survive. Like, even if they are born, they just few minutes to, few hours only they survive. They don't survive because they can't survive without a brain. So but anencephaly is something which we can diagnose in scans. So, not many babies are delivered with, anencephaly, because we don't allow the pregnancy to, to go ahead with anencephaly. Nowadays, we have, advanced scan facilities, and only in village side, where they don't undergo scan, only you see very rare cases of anencephalic babies being, born, till the pregnancy going till 8th or 9th month, because here, anencephaly is one anomaly which can be detected very early in the scan. So as early as, even before the 3rd month scan, around 11 weeks only, the, anencephaly can be diagnosed. And, then we can counsel the couple and we can go for the termination of pregnancy. That means abortion, because these babies won't survive. So The neural tube defects are birth defects, as I told you, of brain and spinal cord. So the closure of neural tube occurs around 30th day after fertilization. So that's why it's very important to supplement folic acid in the very first month, when you don't even know that you are pregnant. However, if something interferes and the tube fails to close properly, the neural tube defect will occur.
So, ma'am, basically,
Hmm.
in pre-conception period, really, we have to be aware about this.
Yes, yes, yes. So,
Beforehand.
yes, yes. That's why, what happens is, like, nowadays, sometimes they just, the couples come and, they're just newly married and, they just come for a regular, gynec checkup. Doctor, we've just come for a general checkup. So, I mean, they will tell, okay, no, now, right now, we're not planning to get pregnant. So we always advise them that, when you're planning to get pregnant, when you start planning your pregnancy, please visit us, 3 months before that, so that we can start you on, folic acid, and these things are prevented. Because very, it's a major defect, and there's so much mental and trauma attached to it, and just supplementing with the folic acid can prevent this defect. So why not do it? It's very doable thing, right? So it's just like, they need to start on the right time. So if they just get in touch with a gynecologist, they can, we can just start them on folic acid, so that this thing is 100% prevented. We can prevent it actually 100%, because the prevention is so easily available.
Exactly, ma'am. That such a small tablet can prevent
Exactly,
such a
that's
big
what.
thing.
Yeah, it's very, very small tablet. If you see the size of folic acid tablet, it's like one of the smallest tablet available in the world, I would say. So it's just a very small, and just you have to take just once a day. So, and it can prevent such a grave situation. The baby boy getting born with some neural tube defect, and then after that getting surgeries done, and it's so traumatizing for the parents as well as the family. So this slide shows us the origin of neural tube defects. That is, the malformation occurs during there's a step of neurogenesis, neurulation. So 26 days exactly after fertilization. So this is the first step in the formation of central nervous system. So mainly the brain and spinal cord. So neural groove does not close completely. So that is when the neural tube defects happen. These are the causes. If we can find out some causes, there are some exposure to certain drugs, but those are very rare drugs. And there are some chromosomal disorders and maternal alcohol abuse, exposure to saunas or high fever. And there are a few genes also that have been identified that increases the risk of neural tube defect, but most common is the deficiency of folic acid. So anybody wants to ask something regarding that till now?
We are clear about this, ma'am. We have a question.
Yeah.
From Aditya.
Yeah.
Is 18 years the right age to visit a gynecologist?
Yes, yes, yes. I mean, visit to a gynecologist can be, as early as, like 9 years, 10 years also. And, as and when they, as soon as they attain puberty, they can visit a gynecologist. We can, it may not be a proper, examination, but it can just be a conversation about, how to take care of your hygiene and, all those, the hygiene about the vagina and all those things, and we can just converse, and we can just tell you that when do you really need to visit us, what are the normal things and what are the abnormal things, and when you should visit us, or when is the right time to approach us. So definitely, I mean, she can visit, and we can talk about the vaccine for cervical cancer, and these all discussions can happen in the first visit, not exactly the gynecological examination. I know, because if I say that, everyone will get scared. Anything? Any other questions there, Zoya?
No, ma'am. You can continue.
Okay. So This is about, yeah, a little bit more detail about the neural tube defect. There is something called, spina. I told you it's mainly like spina bifida and anencephaly. So spina bifida is, is classified into two types: spina bifida occulta and spina bifida cystica. So occulta is actually the least severe kind of spina bifida, and cystica has my meningocele and meningomyelocele. So I'll show you pictures that will make you understand it better. So see, this is, the spina bifida occulta, which will just be seen as, in that lower part of the spinal cord region, the lower back, you'll see some kind of, hair growth. And when we do an MRI scan, we can see that, a particular part of spinal cord is not fused, but then it doesn't have any severe symptoms. So that's why it is called occulta. Occulta means hidden. Then there is something as meningocele, and then there is something as meningomyelocele. So in meningocele, the spinal cord is protruding through that defect where the spinal cord is, not fused. And the meningomyelocele, which is the severe form, in that, the inside part also is coming out, into protruding out from that defect. So this is again one more picture. You can see the spina bifida occulta. It has got, the spinal cord is not fused, but then there is no protrusion at the backbone region. Meningocele has a protrusion, and, meningomyelocele has, the inside matter also of the spinal cord is protruding into that sac. So same thing. Common birth defects are the neural tube defects. Most common are anencephaly and spina bifida, and it's all because of deficiency of folic acid. Because due to the mutation of a gene for an enzyme that is related with folic acid. So that mutation happens, and the folic acid is not utilized or produced in the body. So, and if you don't take folic acid supplement, then, there's deficiency of folic acid. So treatment depends on the severity of complication. Anencephaly, as I told you, these babies don't survive. Spina bifida, meningocele and meningomyelocele, they need aggressive surgical management. You can see this, it will look like this, when you see a baby with neural tube defect. There's a protrusion at the back, lower back. So anencephaly is the absence of major portion of brain, skull and scalp that occurs during embryonic development. And infants with this disorder do not survive longer than few hours or possibly days. Like days also, it's very difficult. They just hardly survive for few hours. So this is how an anencephaly baby looks. This is another kind of neural tube defect, though a little rare. Encephalocele, sometimes known as cranium bifidum, is a neural tube defect. It will, it is characterized by sac-like protrusion of the brain and the membranes. Just at the back of the head, you can see the picture. So these babies will have a lot of neurological problems. Hydrocephalus, where the head is very big. Then spastic quadriplegia, that means they'll not have any strength in their, arms and legs. And then microcephaly, that is the size of the head is very small. Anybody wants to ask something? Zoya, do we have any questions?
No, ma'am. If they post something, I'll let you know, ma'am.
Yeah, okay. So, the big question is, do everyone, do I need folic acid? Yes, every woman should get 400 micrograms of folic acid each day in addition to eating food with folate from a varied diet. I told you which are all the rich sources of folate. Even if she does not plan to become pregnant, because our bodies, as you said, no, Zoya, like it's big, it's useful in skin, hair, and nails, the development, and they make new cells like skin, hair, and nails. So start a healthy habit today by getting 400 micrograms of folic acid every day. There are some medications which they antagonize the folic acid in our body. They don't allow the folic acid to be formed in its natural form in the body. So these drugs are associated with the increased risk of neural tube defects. So these are the anticonvulsant, the anti-epileptic medications. So when they get pregnant, and if the woman is a known case of epilepsy on anticonvulsant medication, so we change the medication to a safer one, like valproic acid, phenytoin, phenobarbital. These are all medications which are used in epilepsy, but they antagonize folic acid. So automatically, whatever folic acid, if they eat also, that will that will get antagonized, and it will not have any effect. It will not be, the blood levels will not be maintained. So the neural tube defect will eventually happen. So we have to change the anti-epileptic medication to a safer one, which are safe in pregnancy. And when a young patient with epilepsy, when a young woman with epilepsy, generally they start her on the safer kind of medication, because anytime in a due course she may become pregnant. So I'm almost finishing my presentation. I would like all of you to come up with questions, and what are your, other, even in fact, other topics also we can discuss. I mean, it need not be only folic acid. So, they'll have a lot of general questions in mind to a gynecologist. So, a lot of you will be having.
Yes, ma'am. Just one question that I had in mind. You said there are some natural folate resources, ma'am. Can you mention a few for us, ma'am?
Yeah. So these are all the good sources of folate. Beans like lentils, black beans, green leafy vegetables, avocado, eggs, peanuts, citrus fruits. These are all the good sources of folate. But as I told, no, they will not be able to fulfill the demand of 400 microgram, which we need to prevent the neural tube defect in babies.
Problem with these nowadays is our junk food, ma'am. So basically all things mentioned here, I think we eat them very rarely.
Yes. And I think even the the quality of vegetables, they are full of pesticides now. So I don't know, like, how much the real I mean, we do say good sources, but how much really do we get, how much really gets absorbed in the body, we don't know. Anybody has anything in mind?
Ma'am, a person.
Zoya, okay, sorry. Shall I go ahead?
Yes, sir, sure.
Yeah. So it was really nice presentation, and it was nice listening to you. Since I'm a part of Protract, and we all are here because of that.
Yeah.
So to my young friends here, how is that we can take part in creating an awareness on the deficiency of folic acid and also its importance, especially in the rural sector? So if you would give us some resources available or your availability, so probably the retractors can also think of some project specific to rural areas.
Yeah, I think we can, do some awareness, camps kind of, or awareness talk or something, I don't know how much, they will understand from a webinar, but yeah, even the, going there and, approaching them and making them aware regarding folic acid and, how a simple supplementation can prevent such grave, this thing, complications in their, baby if they plan to get pregnant. We can do that. So I think that will help them in, if like, somebody telling them from face to face, and that will create a good impact on them.
Are you aware of a routine practiced by the Anganwadi, or it may be the government the PHCs
Yeah,
in the
yeah.
rural sector? Do they have a routine awareness on this, or sessions, or it may be
I'm not
reaching out
sure.
to?
No, I don't think so. I'm not sure. Need to check that.
So probably that is something we can
Correct.
involve ourselves in, maybe selecting a
True.
particular area and
True.
doing on
True.
foot, because webinars won't help, especially
Yeah,
the
yeah,
rural.
definitely. Webinars is like you for people who can, you have access to, those people don't have access to good internet. So like they won't be able to attend webinars even if we conduct also. And for them, I think the impact will be good if we go and talk to them face to face rather than on the screen.
Right. Thank you, Zaya.
Thank you,
Thank you.
sir.
Thank you.
Actually, this topic, many of us also weren't aware about this, that such a small tablet can make such big impact. Also, ma'am, we have another question.
Yeah.
How would we know if we have a folic acid deficiency? Like, how can we identify we have folic acid deficiency?
Folic acid, how do we know you have folic acid deficiency?
Yes, ma'am.
No, unfortunately, we don't have any blood test to do that. But then, if you just keep taking the folic acid supplement, the 400 microgram, what is the recommended dose, and whatever diet you are following, little amount of folate goes, I don't think that, you will be severely deficient in folic acid.
We have another. Yes,
Ask. Yeah.
Another question. It's regarding periods, ma'am.
Yeah.
Normal to skip periods for a month when I have my exams. It doesn't happen the month I have exam, and it goes on just normally later on. Like maybe during exams, missing your
During
periods.
exams, yeah, it is perfectly normal to have that due to stress levels. And if it's coming back to the regular schedule, I don't think you need to worry about anything. And PCO is very common in nowadays young girls. So probably whenever you get time, you can just, undergo a scan and consult a gynecologist. But there is nothing as such to worry that you're skipping periods during your exam days. And stay well hydrated, and have a active routine, like people who are who have a sedentary lifestyle, they tend to put on a lot of weight, and it does have irregular
Lady, turn around, turn around. Sorry for that, ma'am.
No problem. No.
You can proceed, ma'am. Sorry for the disturbance.
No. So it is completely normal to skip periods during exam time because of the stress. And as I was telling about sedentary lifestyle, so people, the girls who have too much of sedentary lifestyle, they just sit and not active in their routine life. Those girls tend to put on a lot of weight, and then weight in turn, fat has a effect on your periods, and you get, the cycles are actually irregular when you tend to put on more fat. So be active and follow a good healthy lifestyle, and stay well hydrated. The fluid intake, the hydration is very, very important for everyone, be it any age group.
Mom, I also heard about this injection, which costs around 16 crore rupees to like to cure spina bifida. So, is it really true, Mom? Like something?
Yeah, there are a lot of advances in surgery as well as the medications for. But in spina bifida, most of the times the child will need surgery than medication. That is what is my knowledge about spina bifida. This 16 crore injection, I actually really haven't heard, but I will check it, Zoya.
Yes, Mom. Since then only I wanted to start to spread this awareness beforehand.
Most of the times, what cases what we have seen, and most of them need surgeries to correct that defect in the spinal cord, so that they can lead a normal life. And surgery followed by physiotherapy. That needs a long period of physiotherapy also after surgery. And are you all aware, are you all girls aware of the vaccine for cervical cancer? Just this, off this topic.
Not really, Mom.
Not really. Anybody who has taken the, because as I can see, I think they're all female crowd. Anybody has taken the vaccine for cervical cancer? Cervarix or Gardasil, these are the two vaccines. So we have three vaccines actually available now in India for HPV virus, human papilloma virus, which is a major, risk factor and the causative factor in causing cervical cancer, and which is, the HPV infection can be prevented by taking this vaccine. So in turn, you can prevent getting cervical. I mean, I will not say it will prevent 100%, but yes, the major role is played by human papilloma virus. So we can prevent human papilloma virus infection and in turn prevent cervical, at least reduce the incidence of cervical cancer. And the age group when it can be taken is as early as 9 years of age. So Gardasil comes in 3 doses that you have to take at 0 month, 2 months and 6 months. And Cervarix is taken as a month apart, 2 doses. So I would request all of you to please approach your gynecologist and go with this cervical cancer vaccine. You can approach us as at Altius Hospitals. We do have all the vaccines available.
If I'm not wrong, recently there was one drive from Altius along with an innovative
Yes. So we are trying to create a lot of awareness about that, because that is something which is very doable, and it can prevent a lot of problems.
Probably President Vaishnavi is here. She can think of arranging one in collaboration with Altius for Jyotirma's College.
Yes. There are some questions in the chat window.
Mom, does folic acid have any side effects?
No, not really. The toxicity comes at very high levels, but that much, we don't take, right? So not really. How effective are these vaccinations? As I told you, cervical cancer is caused by the major causative factor is human papilloma virus, And these vaccines are against the strains of human papillomavirus which are known to cause cervical cancer. So definitely it's a preventable thing. Somebody has asked, ma'am, is it okay to take tablets for periods pain every month? Yes, if the pain is too much and it is hampering your daily life and daily activities, yes, you can take 1 or 2 tablets a day. But try to get in touch with your gynec as to why so much of pain. You know, sometimes we have some or the other reason for that pain. So if we can treat that reason like endometriosis, sometimes the uterus becomes, swollen and thick, that is adenomyosis. That's when you have a lot of painful periods. So you can approach your gynecologist, and if they can find out a reason, they can treat the reason. Otherwise, it's fine to take tablets every month, 1 or 2 per day. Somebody has asking which vaccine is preferable. Both are found to be equally efficacious, Gardasil as well as Cervarix. The only difference is Cervarix is effective against 2 strains and Gardasil has a more coverage. It is effective against 4 strains. The efficacy of both is found to be same.
Ma'am, nowadays there are gummies and juices regarding to folic acid. So is it better to take those gummies and drink the juice, or tablet form is
No, tablet
better?
form is better because the absorption is better.
Yes, ma'am.
So tablet is much better than these gummies and juices. And I'm not sure what concentration they are, telling they are, whether it's really true or not. So we as doctors, we always prefer to prescribe tablets. When can we start the consumption of folic acid? You can start it right from today. As I told you, you can start with a healthy diet and include 400 micrograms of folic acid in your daily supplementation. Even if you does not plan to become pregnant, at least that folic acid will be used to make new cells like your skin, hair and nails.
It was really nice listening to you, Dr. Pooja.
Yeah, I hope it was useful for everyone.
Definitely, ma'am.
Guys,
You can use this opportunity and ask your questions. We have Dr. Pooja here, and this is a great deal. Like, any questions, just post it online.
Yeah. Is there an age? When can we start the consumption of folic? Okay. Is there an age limit to take cervical vaccine? The vaccine for cervical cancer is ideally to be taken before a girl becomes sexually active. So the earlier, the better. But even if you take it, like, you've not taken it till now, you were not aware of it, you can take it right now also. So prevention may not be 100%, but yes, definitely you will get some amount of protection from human papilloma virus. Ma'am, can you tell us about white discharge? Is it normal? Yeah, slight amount of white discharge is normal, depending, just before you're getting your, depending on which part of your cycle you are, just before, when you are in a secretory phase, that is just before getting your periods, if you're getting slight white discharge, it is normal. But then once again, the white discharge should not be smelly. It should not be like, thick, curdy white. That's when you have to suspect that there is some infection and it is not normal. So please consult your gynec. Yeah. Ma'am, what if we bleed for 2 days only with no pain during periods? It is completely fine. Periods may last for 2 to 5 days on an average. And if there is no pain also, it is completely fine. Not everybody has pain during periods.
Ma'am, we have another question. Does folic acid give like special energy or something?
No.
And also, ma'am, why do some mothers are not able to feed to the infant after the childbirth?
That is a completely different thing. For everyone, pregnancy and childbirth is very different. Everyone's body is different. So for some people, lactation doesn't establishes properly. But then, if they give some time, and most of the time stress is the main reason, because they will become mother, and suddenly there are so much of changes in lifestyle, and sleepless nights and all those things. So most of the times for the poor lactation, stress is the main thing. But yes, if we give some time and if they get proper support, and encouraging team is there to encourage them for breastfeeding, I'm sure they are able to do it. We have seen patients, first initially 2-3 days, 4 days, they will not have any lactation, then then after that it will start, and then they are able to feed their baby. I had PCOD, and now I have been getting periods normally after 8 months. But it's only 1 to 2 days of only spotting, and my cycle is about 20 to 23 days. It's like this since 2 months. I would like to know whether you've taken any medications for that. Would like to know more about the history. Yes. You can come. Yes, I have Ayurvedic medication. I'm not sure about the Ayurvedic medications, but then you can just meet me in the hospital, or just come down once, so that I can talk to you face to face and have a better understanding and make you understand better about what's happening. They say that HPV vaccine is not recommended for women who are older than 26 years of age. See, as I told you, ideally what they say is cervical cancer vaccine should be taken before a girl becomes sexually active. So the sooner the better, because they are exposed to human papilloma virus through this thing, sexual intercourse. But you can take cervical cancer vaccine even if you are more than 26 years of age.
Yes, ma'am. So for the participants, the feedback link for the webinar will be shared. For YouTube, we'll be sharing it on the comment section, and for Zoom, we'll be sharing it in the chat box window. And the feedback link will be open for 10 minutes only. And also, let me take this small opportunity to promote our next webinar that is coming on 10th April, Sunday. it's related to day-to-day hygiene. So we can have more of your queries answered there too. And thank you to our participants for asking these questions. I would like to call Protractor Brinda for vote of thanks.
Somebody is asking one question is there, Zoya. Excuse me, 1 minute.
Sure, ma'am.
Yeah, there's one question. Ma'am, what if we get periods twice a month? Like first it occurs in the starting of the month and then again at the ending of the month. Any cycle between 22 to 32 days is normal. So if it's the periods are occurring in that gap, I would say there is nothing to worry about. But if it's more frequent than that, then you can just, come down and just visit us, and then, we can take it like, what is to be done and what all investigations need to be done. Sometimes thyroid, sometimes hemoglobin is on the lower side. So I'm not sure how many of you are aware of our LTS hospital. So we are at HBR layout. We have all, facilities. It's a multi-speciality hospital. So you can, for any problems, anything, you can come down, and we have doctors from all specialties. And all the diagnostic facility, everything is available here under one roof. So please do visit us if for any queries and any problems. You can always book an appointment and you can always come down and see us. Thank you.
Good evening.
Thank you.
It gives me an immense pleasure to thank Dr. Pooja Sani to take out her time out of her busy schedule to grace us with the event. It was an insightful session, and I hope we all continue to spread out this awareness among young adults. I extend my gratitude to our knowledgeable principal, honorable principal, Dr. Sister Larita Thomas, and our faculty coordinator, Mrs. Sharon John. Special thanks to Redactor Srinidhi for his constant guidance and support throughout. A partner Rotary Club of Swarna Bangalore. I would also like to thank our Rotary Club of Koramangala and special mention to the Board of Director members of RCJNC for their support. Last but not the least, I would also like to thank our wonderful participants. Thank you.
Thank you all for giving me this opportunity. I hope the session was useful for all of you, and at least you learned something. So
I would like all participants to please turn on their cameras for a quick clip. Please. All the participants, please turn on your cameras for just one picture. Thank you everybody.
thank you.
Thank you, Dr. Pooja, once again, and hope to see you in the ITS hospital sometime on the way. I'll surely come in and meet you once.
Yeah. Thank you so much. Thank you so much, everyone.
So yeah, I guess we missed president in the group picture. Can we have it once again, if it is possible?
Yes, sir. Yes, sir. Yes, sir. Done, sir.